Hey everyone, Kevin Henry, editor-in-chief for drbicuspid.com. Thank you so much for joining us for another episode of the drbicuspid.com podcast. This is a continuation of a series that we are doing in conjunction with Catapult on products out there that are earning the Catapult seal of approval and are going to help you in your dental practice. And I'm thrilled today to be joined by Dr. Ankur Gupta. Dr. Gupta, how are you, my friend?
Great. Thank you for having me on, Kenry.
It's all good. Hey, I'm so glad you're on, and I appreciate you taking time out of your busy schedule. Before we dive into talking about the Kettenbach QuickSplint, would love for our audience just to know a little bit more about you, if you don't mind.
Yeah, sure. I've been a dentist for a little over 20 years, and my wife and we practice together in a small private practice outside of Cleveland, Ohio. And I think that the thing that the two of us realized is even though we are racking up year after year of being dentists, certain things just are still hard. Certain things are still challenging and stressful and sometimes unpredictable. And I think the unique opportunity that I have as an educator is I just get exposure to a lot more new products, new techniques, new strategies to handle harder things. And that it just gives me more opportunities to try stuff out. And it's a real blessing because I get to try products like the QuickSplint by Kettenbach, realize how easy that makes things for me, and then I get to share that with other dentists. And so hopefully we get to talk a little bit about that today.
Absolutely. And I'd love for you to share with those other dentists what was it that first not only drew you to the QuickSplint, but also excited you about it as well.
Yeah. Okay. So I have now, after 20 years, taken, I don't know, like 1 billion courses on TMJ. Like I've taken like so many reconstructive courses, TMJ pain courses, TMJ dysfunction courses. And I can still honestly say I don't totally understand. I think my brain's just not big enough. And what I found in practice is that 85-90% of cases are improved with a bite splint. A bite splint helps in 85 to 90% of cases. And then the 10% that it doesn't help with, I'm happy to send those patients off to somebody who's smarter than I am. However, the thing about a bite splint is that there's two major limitations. Number one is some patients just don't believe you. They're like, well, I don't see why I need something like this. And then number two is some patients who are already having a lot of pain, they're having a lot of discomfort. I can't give them anything right then and there. There's no solution that I can provide to them in real time. I have to say, okay, well, let me take a scan of your mouth or an impression of your mouth and see you back here in 3 weeks to help you. And I feel like the QuickSplint came along and satisfied those two major limitations and probably a few more.
So I'm curious because I was going to ask you about getting patients on board. How does QuickSplint help get patients on board?
Okay, so let's talk about that. So let's say I have a patient and there's so much evidence that they clench their teeth, they grind their teeth, and we don't have to go into all of that because every dentist that's listening knows what that evidence is. The occlusal wear and the abfraction along the gingival part of the teeth, the popping and clicking when the patient opens and closes their mouth. So let's say I have that patient. And I say, yo, man, you clearly have a occlusion or TMJ issue. And that's why I'm seeing all of this evidence. And the patient's like, I don't know. I don't think I grind my teeth. I don't think I clench my teeth. And I'm like, yeah, but you do. And they're like, yeah, maybe. I don't know. I don't think I do. Well, that's a tough thing to overcome. I mean, it's just me staring at the patient staring back at me. I think they do something. They think they don't. And so what I like to have is something that's very inexpensive and immediate and simple where I can say, okay, here's the deal. Maybe you don't, but I'd like you to try this. It's very inexpensive. It's something that I can make for you in about 2 minutes, and it'll tell us a lot. You might wear it and say, oh my gosh, I had the best night of sleep that I've had in a long time, or I felt better the next morning, or boy, I really mangled the crap out of this thing. So clearly I have some type of clenching or grinding issue. And this thing will tell us a lot, and I can give it to you for a very inexpensive price. That's a very easy conversation to have. It's not this conversation where I'm acting like I'm right and they're wrong. I'm just saying, hey, let's just try this thing out. And that's been very, very beneficial for me in having this conversation with patients. Okay. So that's number one. And then the other thing is those patients who have symptoms and they just want a solution right away. They say, Doc, the reason I came to you is because I'm having jaw pain, or I'm having this real weird clicking thing and it's annoying me, it's scaring me. And I say, okay, well, let me give you this device right now, inexpensively, to see if some of those symptoms go away. That's an easy conversation to have.
And I love during the conversation, you're talking about not only cost, but convenience as well. Because you're saying, hey, this is quick. We can make this happen while you're here. It doesn't mean that you've got to come back. And I think that those are things that click, for lack of a better term,
Yeah.
with the patient.
Yeah, they do. They do. And, of course, there's always a case where a patient's like, hey, I tried this thing. I couldn't wear it. I couldn't fall asleep with this thing in. And then I think, well, that's great. That's great that we know this now, rather than me making you a $500 occlusal appliance and then you realizing like, I don't like, I can't fall asleep. I can't get used to it. I don't like something in my mouth. That's great. Then we can maybe talk about other alternatives rather than me giving you this incredibly expensive thing that you end up not using. And so even when I have a negative result, I still see it as a positive.
And in your practice, I'm curious, how does your assistant or your team members play a role with not only the production of the splint, but also maybe some of that communication that you just talked about as well?
Yeah. Okay. So Kevin, the jig is up for me. I'm acting like I have all these conversations. It's always like, oh yeah, I'm talking to this patient and me and this patient are talking. Dude, that happens maybe about 30 to 40% of the time. Most of these conversations happen with me not even in the room. And that is the hygienist is doing the cleaning. The hygienist is noticing all of this occlusal wear, and the hygienist says, hey, I can tell you grind your teeth at night. And then that conversation's happening without me in the room. Sometimes the fabrication of the splint has already occurred. The hygienist or the assistant, they've already fabricated the splint. I walk in and they just summarize their conversation. I say, oh, cool, okay, let me know how things go. And so that's the thing about, number one, we're not diagnosing occlusal disease. That's something that dentists seem to have like a real attachment to. We have me, I'm the doctor, so I must diagnose. Well, a lot of cases, we're not diagnosing anything. The hygienist has a suspicion. The dental assistant has a suspicion. They make a recommendation based on that suspicion. This is a tool that helps us determine a better diagnosis. And that means they're off to the races. They have the conversation. They feel comfortable about it. This splint is so easy to fabricate. I mean, I could have my kids, my high school teenage kids walk into the room. They could fabricate this splint because it's so easy. And not that they ever do. I mean, my kids are completely uninterested in anything that goes on in our dental office, but anybody could do it. Somebody from the front desk could fabricate the splint. And so this is the type of thing that takes a very, very, very minimal amount of burden upon the shoulders of the dentist.
Is that the biggest thing that stood out to you about the Kettenbach QuickSplint specifically whenever you were doing this review?
Okay, so probably the thing that stood out to me the most was the ease and simplicity. And then number two was that it was actually effective. There's plenty of things out there that are easy and simple and inexpensive, but I want patients to still love me for it, And what I found is in the maybe 4 to 5 weeks in which I was reviewing this product for Kettenbach was that I got a lot of positive review from patients. Patients saying, I feel better as a result. I'm ready to move forward and have a permanent splint made. Or patients that say, hey, I feel so much better. Let's talk about maybe more comprehensive treatment, occlusal equilibration, or maybe even some reconstruction. That all happened much easier because I have the splint as a tool, the QuickSplint as a tool.
Well, if you're listening to this on the drbycuspid.com podcast, we're going to have the link to Dr. Gupta's article in the show notes. Real easy for you to find and learn more about the Kettenbach QuickSplint and what was loved about it. And hey, if you're watching this on Dr. Bicuspid, well, you're already on the article, so make sure that you're checking it out above where we are right now. But Dr. Gupta, I really appreciate the time today and the insight. Thanks so much, my friend.
It was a pleasure. Thank you so much, Kevin. And I love your periodical. I love the articles, and it's fantastic. So I learn a lot. I appreciate that you're out there and that you're actually providing this for us.
Well, appreciate that. And we're so glad to be working with you, with Catapult. We're glad to have this as part of the armamentarium there at Dr. Bicuspid, and we appreciate you listening to this podcast as well. Till next time, it's Kevin Henry, editor in chief, signing off. And as always, wishing you nothing but success ahead.
Thank you.